Hi, I'm Dr. Chi-Ann Gibson. I practice in Naperville, Illinois as a general practice dentist and accredited member of the American Academy of Cosmetic Dentistry and lab technician. Introduction.
I'm Dwight Rickard from Indianapolis, Indiana, accredited fellow within the American Academy of Cosmetic Dentistry. Chi-Ann is the president, and I'm the president-elect.
From a dentist perspective, the first process is obviously gathering the proper photography and then communicating that with the lab technician that understands what we're trying to deliver. So when they receive the photography aspect of it, a lot of it certainly has to do with communication to know what our end goal is. So from receiving the photographs, oftentimes other practices may they just get a stone model and they work off of that. But in our standards of excellence in care with the AACD, we have to see at every angle the photography. And then from there...
Well, and I think that's the key component. Number one is, we want photography. We want to see what we're working with. In AACD photos, the 12 required shots for accreditation, for example, are really a good example of photos that dentists can provide for the lab. And then, of course, it really does require good quality impressions of the models. And the workup. And so that, what the laboratory, what you hope has the ability to do is communicate with the dentist. Okay, here are the issues with this particular patient, and here are the things we can do from the laboratory side of it to help this patient get from point A to point B. And we can also help give the restoring dentist ideas of what other collaborative efforts that might be necessary from orthodontics or periodontics.
Yeah. So basically the foundational aspect from a general dentist standpoint is knowing that the periodontal health is there. And we educate our patients basically why we do the photography, why we do a workup, so that way we can see how we can best deliver something that is not only aesthetic but also functional. So photography obviously is a key. We have a certain standard of the photographer from different angles. Then we also have the piece where we want to know what the patient's expectations are. So the canvas part with the gum tissue positioning and the length of the teeth and all the little details that come into it is also a process of which we deliver at an excellence level. Most oftentimes we would communicate with the lab technician on a standard, not only just sending out the photos, but also to say, this is what design that the patient would expect, or what we would expect of that. When we talk about the length, the width, the teeth, the shape of the teeth, they're all different variables. And for individuals as our patients who don't know much about it, they entrust us to the design. And they entrust our lab technicians, because a success of a delivery case is not just the dentist alone, but it's 100% of the communication channels between that with the lab technician. And then you can expound on that.
Well, and I think the other thing that's really critical as a case comes in and you're collaborating with the dentist, if you have some type of smile editing software, one I'm using is Smile Designer Pro, and it allows you to see digitally for example, length to width ratios, the whole smile design in the patient's face. And it gives you something to begin with. And then typically in our instances, we're working from that. That's what guides us in the diagnostic wax-up. And then from that, the doctor can make the provisionals based on that diagnostic wax-up. And what you're creating is you're building a foundation before you start the case. My big goal is always to know what it's going to look like before I start the case. I don't want to get a case in the lab that the teeth have been prepared and the doctor says to me, "Hey,
give me something good."
Give me something good. No, we're always doing everything we can to make sure that we know what it looks like before we start the case. The provisionals are really kind of the key ingredient here. This is the stopping point of whether a case continues to go forward or stops and goes back. And if the patient loves their provisionals, man, your money. You just move on and you duplicate those provisionals. But if there's something that needs to change, maybe the incisal edge is canted or the midline's canted or they don't like the shape of the teeth, the things that need to be worked out in the provisionals, phonetics, and so on. And so it's a critical component and a critical point of either you continue the case or you pull back.
That also allows the patient to see the potential of a temporary, knowing that they're going to have something that's delivered far better than what they have in terms of the temporary. They get to test it based on their speech, their bite relationship, the ability to see the line angles, and to say, you know what, I want it changed. And in that process, then we take molds of it, and we take the photography, and so if we want it shorter or a little longer, a little wider, sometimes what we think of what they want can be completely different. And sometimes I'm really happy with the template because it's beautiful, but they come back and they go, I want them really square, but we deliver what they want. And actually you can have, as women have it, they have square, round kind of nails. Some people prefer something completely different, and they still fit their facial aesthetics. And so that part being the critical aspect is to see that they're happy with the shape and that their speech isn't too altered, and that they know that they're going to have something similar to that. And then when they get their final masterpiece from the lab technician, that's when we finalize it with the cementation process, with the standards of the materials that we use. And from that point on, communicating also with the patient the importance of really routine home care and managing the care at home gives it the longevity. So in the end, all of it is a proactive approach from the lab technician, the dentist, and the patient, and with the team. The team helps to deliver that.
And that's really a great question. And one of the things that when people call me, and people meaning laboratory technicians and would like to be mentored on, geez, how did you get where you are? I always say if some of the best places to find new clients is sitting in a room next to other dentists, learning the things that they're learning with respect to the restorative work we're doing, and how it affects that patient's lives. And there are many places you can go to get that education. The one thing about the American Academy of Cosmetic Dentistry is that they always they value the laboratory technician like no other academy, and thus the reason we have a credentialing process for dental technicians. But this is where my clients come from, and my clients want me to be in the room with them when they're going to see maybe an implant course on whether it's tissue grafting, bone grafting, restoring that implant. And so they want me by their side so that we're communicating in the same way, and they don't have to teach me how to do it the way they want to do it, because I was sitting there with them. And so you can have a collaborative conversation on a case and talk the same language.
Right. Basically, as he mentioned, it's like talking the same language. Sometimes you can use a lab that doesn't know anything about the excellence and the standards of care that we want to deliver based on the AACD standards. And once you get more involved with it and the detailing that comes into that, then you realize you have an eye for it. So when it comes to communication, they understand the language of what you're communicating. Oftentimes when people do cosmetic work and they don't have any photography, you're wondering how that communication process is, and then they said, well, this is it. And so the more the doctor knows about the processes, and you deliver it also to the lab technician that knows the standard, that makes it so much easier for the delivery. And the expectations are always at the excellence level. And so oftentimes we see it, the patients entrust us to that care because of the knowledge that we have. And they search out the lab technicians and the dentists that do have, in this day and age with the social media, they do their own research to see who has the educational component that comes with it, and so they're studying more about it themselves. Oftentimes it's really straight, simple when they trust us, and other times there are patients that will dictate exactly what they want, and we deliver that to them and get the message to the lab technician.